Hello, I'm Dr. Mundinger, one of 3 craniofacial plastic surgeons on the Cleft and Craniofacial team here at the Children's Hospital of New Orleans. In addition to the challenges of having a newborn, babies with cleft lip and palate can present additional challenges with regard to feeding. Babies with clefts of the palate have decreased ability to form a seal around bottle nipples or the breast due to the hole in their palate. This can result in difficulty drawing breast milk or formula to the back of their mouth, which can result in wasted feeding effort. Although the baby may look like they are feeding, they are often unable to draw milk or formula out of the breast or bottle. This can lead to long feeding times, exhausted babies and parents, and inadequate weight gain. Here to explain how to ease the feeding process is Mary Ellen Alexander, our team nurse coordinator, who has over 25 years of experience helping babies with congenital facial differences learn to feed and thrive.
There are many different ways that you can feed your baby with a cleft palate. The feeding systems range from simple and inexpensive to more high-tech and expensive. And today I want to show you some of the options that are out there so that you can pick what is the best fit for yourself and your baby. This is a bottle that you often will find at the newborn nursery where you deliver your baby. It's a bottle that is soft and it's designed to be squeezed as the baby feeds, so it's considered an assisted delivery system. It has a small X cut on the nipple, and this is so that the baby puts their gums on the nipple, the X opens up, and the baby gets a mouthful. This bottle is easily found in most birth hospitals, but it does have some disadvantages when you're at home. It's designed to be disposable, meaning you are supposed to just use it once and throw it out. You can wash it and reuse it, but when you do, it often starts to leak. The other thing is that this is a big bottle. It holds 6 ounces. Your newborn baby will probably take a ½ ounce or 1 ounce in the beginning. So it makes it a little hard to measure exactly how much your baby is feeding. The other thing is because it is an assisted delivery system, sometimes adults are nervous about the squeezing as the baby is feeding. So it might mean that your partner or grandparents are hesitant to help you with feeding the baby because they don't feel comfortable using this system. Another bottle that we often recommend is the Dr. Brown's specialty bottle. Now, you may have heard of the Dr. Brown bottle, the regular bottle that's been on the market for a long time. Maybe you've used it or your friends and family have. This is a specialty bottle designed for babies with a cleft palate. It has many of the features as the regular Dr. Brown bottle, but you can't find this bottle in your local grocery store. You would have to order it online. This bottle is designed with a vent, which is common to all the Dr. Brown bottles, and it's useful for babies who swallow more air, and that is common with babies with cleft palate. It has a special valve on the inside, and the valve on the inside is designed to help regulate the flow as your baby feeds. The other nice thing about this bottle is the nipple comes in a variety of sizes. It's 1 through 4, and there's also a micro preemie and a preemie nipple. So if you have a real tiny baby, this might work for you. It also means that as your baby grows bigger and wants a bigger mouthful, you move up the size of the nipple and it should match your baby better. This bottle is designed to be washed and reused, so that is one advantage to it. And there isn't really anything that the adult has to do differently using this bottle other than to put all the pieces and parts together in the correct order. So that does mean you do have to keep track of that when you're washing and reassembling your bottle. You can't buy it at the grocery store, so you do have to plan ahead. If you're a parent who is pregnant and you know you're having a baby or you're expecting you may have a baby with a cleft palate, it might make sense to try and order this in advance of the birth of the baby. Another bottle that you'll sometimes see it's really just the nipple system. It's called the pigeon nipple. Instead of an X cut in the nipple, it has a Y cut in the nipple, but the idea is still the same, that when the baby's gums close around the nipple, the Y opens up and the milk comes out. This also has a little valve in it to help regulate the flow. The pigeon nipple can be purchased with a bottle attached, or you can buy the nipple by itself. They come in a pack of 2 and put it on any bottle that you already have. The pigeon nipple comes in two sizes, a preemie size as well as a regular size. So if you do have a baby who's tiny and born a little early, there is an option for you. Sometimes we do find that since there's only one size for everyone else, that as your baby gets bigger and sturdier and wants a bigger mouthful, this may not always flow as fast as your baby would like. Another bottle that is sometimes used is this Medela special needs bottle. A lot of times you hear people in hospital call it a Haberman because that's the old name it used to be known by. This is an assisted delivery system. So once this barrel is filled with milk, the caretaker is supposed to be squeezing as the baby feeds. It has a valve in it, like some of these other bottles, and that valve helps regulate the flow of the milk. It also has 3 designations on the nipple to help you go either slow, medium, or fast in terms of feeding the baby. This bottle is especially good for babies who have Pierre-Robin and cleft palate, or babies who have other kind of medical conditions, maybe something cardiac, neurological, an extreme preemie, a baby who has trouble with the breathing and feeding coordination. This is the most expensive bottle that is out there. You can't buy it at the grocery store. You would have to order it from a hospital, a medical supply, or online. It's a great bottle if your baby has medical complications, but I often feel it's a little bit more than you need if you have just a regular healthy baby who happens to have a cleft palate. If you can't get a hold of any of these bottles right away, one tip that you can use to get your baby started feeding is to simply cut an X in the nipple. The idea again is that the baby's gums squeeze the nipple, the X opens up, and they get a mouthful. It's tailored so that the size of the X kind of fits your baby. So that means you may have to experiment a little bit, and sometimes people are hesitant to do that. If it's going too slowly, you simply cut it bigger. It's easiest to have something like a scalpel that the newborn nursery could give you. I've had families who've used a brand new X-Acto knife or some sort of razor blade. The idea is to make the X thin, not wide and bulky. And then that way, when you're feeding the baby and the baby needs to pause or it's time to take the nipple out of the mouth so the baby can burp, the X will close up and not drip on the baby as you're taking that pause. So that's always a good method to start with if you're not yet have one of these other bottles in hand. 2 other tips for feeding your baby with a cleft palate have to do with positioning and burping. Because your baby's nose and mouth are connected, your baby will swallow a little more air. And if your baby has a wet burp, the feeding is more likely to come up through their nose instead of out their mouth. So it helps to have your baby in a more of an upright position. You can certainly have the head relaxed so the baby is looking up toward the ceiling, but if the trunk is more upright, that will help keep milk from flowing out the nose as your baby is vigorously feeding on the bottle. The other thing is that your baby is going to swallow a little more air, so you'll need to burp your baby. We say usually about 1/3 of the way through the feeding, again 2/3, and again at the end. You want to make sure that your baby doesn't get fooled with a big air bubble and think it's full when really it just needs to have a good burp. And as you know your baby, you will get cues from your baby that it's time to slow down, take the bottle out their mouth, and let them burp. That will help your baby then get ready to get right back to feeding and get a full tummy. The important thing to know is that here at the Cleft team, we want to help your baby be well fed and satisfied, and we want you as a parent to feel comfortable that you know how to nurture your baby. So please contact us so we can help you get a good start.
If you have a baby with cleft lip or palate, or are pregnant and expecting a baby with a cleft lip or palate, and would like further information or to meet one of our craniofacial plastic surgeons, please call our cleft and craniofacial team here at the Children's Hospital of New Orleans at 504-896-9857 extension 2. We offer a full range of services for children with craniofacial differences from birth through adulthood in our multidisciplinary cleft and craniofacial team, which is approved by the American Cleft Palate Craniofacial Association.